You're watching the Fox 5 Morning News at 7.
Rise and shine, Mount Soledad camera. Look at this view as we see the blue skies live in La Jolla. Hope you're having a great morning. 7:41, and some doctors say that flu shots to save lives, but this year there's one major change. Fox 5's medical expert Dr. Chaffoo is here to explain. Good morning, Doc.
Morning, Heather.
So I know you talk about vaccines and shots in California and you get a lot of differing opinions, but for you as a doctor, why do you think that flu shots are helpful?
Well, Heather, they're really important because, it's important for the public to understand that flu is not just like a bad cold. There are serious consequences from flu. There are deaths every year, of course, and there are associated infections. One can get ear infections, you can get pneumonia, seizures, encephalitis, infection around the brain. And so certainly it can become a serious illness. I've actually myself gotten flu a number of years ago before I got a vaccination. I was really ill for quite a long period of time. So it's not a benign disease. It's not something to take lightly. And certainly we want to make sure that vaccinations start very early on. Heather, the flu season starts around December and goes through March. And so people are starting to delay. Well, maybe I'll wait for the right strain or right, vaccination to come out. The truth of the matter is it's better, the CDC recommends, to go ahead and get this vaccination as soon as possible, and they recommend that by the end of October or by Halloween. And the reason is that it actually does take a few weeks after you've gotten the vaccination to build up immunity to the 3 or 4 strains of flu that are very prevalent this year.
Well, and depending on where you're traveling throughout the holiday season, it might be stronger. The flu might be stronger in some other states or countries, depending on where you're going. So it's smart to make sure that you and your family are safe. I want to talk about a change, though. There's a major change in the 2016 vaccine. What is that?
Well, the major change is that in the past, Heather, you could actually get a nasal spray. And now the CDC has come out and said, you're going to have to get a vaccination. The nasal sprays are really ineffective. And so it's just changed in that regard. And the second is that there are 2 different types of vaccines available. There's one available, it's called a trivalent. It's for the H1N1 or the swine flu, for the H3N3 and the type B. And then the second immunization that's available is for another strain of type B. But the CDC has come out and said, go ahead and get the vaccination. Don't wait for the ideal one. There really isn't an ideal one.
So do you have an option when you go to, whether it's a pharmacy, a doctor's office, wherever you're going, and what is the vaccine that you should get? Sorry, I just want to make sure to clear up what you just mentioned, because you said there's several different vaccines.
There are 2 different kinds. There's one that protects against 3, the trivalent one, this for 4, but the CDC has said, that the moderated form of the type B is not that common, so you really want to go ahead and just get whatever flu vaccine is available now. Go ahead and get immunized.
I know a big concern with vaccines and shots is mercury always, whether it's with children, whether it's with pregnant women. Is there an option, and can you ask your doctor for a mercury-free vaccination when it comes to the flu? Well,
that's a great question. So, mercury is a commonly occurring element. It's found in what are called these multi-vials for multiple drugs. From one vial, and the mercury prevents actually bacteria from growing. The truth of the matter is, Heather, that the MMR and the flu and many other childhood vaccines not only do not contain mercury or thimerosal, but have never contained those. So there was a big issue. Well, is mercury related to autism? There was a study that came out that was actually debunked. And actually there's no evidence. In fact, when the thimerosal many years ago was taken out of a few of the vaccines, we actually saw an increase in reporting of autism. So there's no association or link between those. And in fact, most of the vaccines today do not contain thimerosal.
And I know that's a much longer conversation for us to have, but I want to move on to this question really quick. Americans, it's considered that we're now free of measles. So was this due to the vaccinations? How did this happen?
Well, it happened because of great public efforts to get people vaccinated. So both in North America, Central and South America, all the Americas are now measles-free zones. But it doesn't mean you shouldn't get vaccinations because, as you mentioned earlier on, we are a global society and people travel freely throughout the world, and measles is still a very serious illness in other parts of the world. We eliminated smallpox, we eliminated polio, we eliminated rubeola, and what's called the congenital rubeola syndrome, essentially because of very strong public outreaches for public health officials to get vaccinations done, but it doesn't mean you should let your guard down. Still continue to get your vaccinations on the schedule that your pediatrician recommends.
Oh yeah, it always makes me think of, you know, when this time of year comes around, you feel the weather getting a little cooler, someone starts sniffling, someone starts coughing, and we all start thinking about it around the office. So Dr. Chaffoo, great information. If people want to get their flu shots, as you mentioned, you're supposed to do it this month, so you better be thinking about it. Dr. Chaffoo, thank you very much.
Thank you.
All right, time now is 7.